Extreme heat sweeping across Asia. Temperatures in parts of the region are so high, it's not just uncomfortable, but unhealthy. Heat exhaustion is a common risk that could affect anyone. It can include dizziness, headache, shaking, and thirst. It's usually not serious as long as the person cools down within 30 minutes. But heat stroke is its more serious version. That's when the body's core temperature goes above 40.6 degrees Celsius, exhibiting symptoms like rapid breathing, confusion, or seizures. A heat stroke is a medical emergency that can cause long-term organ damage and even death. Some people are more at risk due to extreme heat. They include babies, the elderly, and those who are more exposed to high temperatures, such as homeless people. The heat could also exacerbate existing conditions such as respiratory and cardiovascular diseases. A study in 2021 showed that just under 500,000 deaths a year are estimated to be due to excess heat. And over in Europe, as many as 61,000 people may have died during heat waves last summer. For more, we are joined by Kathryn Bowen. She's a Deputy Director of Melbourne Climate Futures. She's also Professor of Environment, Climate and Global Health at the University of Melbourne. Professor, thank you very much for your time. Firstly, we've been hearing reports of heat index in some countries in the region soaring well above 40 degrees Celsius. Just how much heat and humidity can the human body withstand?
Well, as you described, many parts of Asia are in the thick of incredible heat at the moment. And we do have thresholds, physiological limits to heat. We know that the higher the temperature gets, the more our bodies have to work to be able to cope with that heat. So what part of the issue that we're seeing now is that overnight temperatures aren't dropping. So they're not allowing our bodies to cool and recover after periods of intense heat. So that's really one of the biggest challenges we have ahead of us, is that physiologically we cannot maintain these high levels of internal heat due to the extreme weather events we're seeing. We must be able to cool down overnight. And it's those overnight temperatures, if we don't see that they are dropping, that will really be catastrophic for human health and well-being.
Well, Professor, we know that Asia is warming faster than everywhere else, just about, with the World Met Organization saying the trend is actually accelerating. So to your point about, the inability of temperatures to fall down sufficiently overnight, from a healthcare perspective, what happens when a population is faced with a persisting jump in temperatures?
So there are the direct physical health impacts of heat. So as we know, heat stroke, we will see an increased attendance of people in hospitals, in healthcare facilities. So that has massive ramifications for our healthcare system. Do we have the system that is able to provide that surge capacity in these times of extreme weather? In many countries in Asia, we might. But in other parts of Asian countries, so those that are less resourced, for example, there won't be those healthcare facilities and those hospitals that are able to respond and treat to a massive influx of patients coming through the door. So we see this in many occasions of extreme heat, is that our hospitals just cannot deal with the demand. And we know that with the projections around the increase in intensity and frequency of heatwave events, we must ensure that our healthcare facilities are prepared. But there are other impacts of heat on us as humans. It's not just the physical side, but it's also mental health and emotional health. We know that with a prolonged duration of heat, it does start to impact our mental health and our well-being. So there's more research starting to appear that's connecting the dots between increased heat and mental health, and also violence. We do see violence increase on hot days and periods of extreme heat. So there are a number of other impacts to health and well-being beyond heat stress and heat stroke and those more physiologically based health impacts.
Yeah, interesting, Professor. And Arnold and I are joining you from Singapore, where it's known for its searing summers. I wonder, what does the hotter global temperature mean for people in places that are already so hot to begin with?
Yes, well, there's some level of adaptation we can manage as humans, but we absolutely have a limit to our adaptation. And this is when we must look to adaptation within our environment, like reducing the urban heat island effect, for example. So more green space in our urban centres in particular. We know that we must really move rapidly so that we can design cities in a way that will protect human health and well-being. So there are a number of interventions we can look to, both in the adaptation space, how we're going to respond to the health impacts of heat, but also critically, we must be mitigating. So we must be rapidly accelerating our greenhouse gas emission reduction strategies all across the world, because climate change has no boundaries. And we know that those countries that are most responsible for emitting greenhouse gas emissions will actually feel the brunt of it less. So richer countries must really be taking the lead in rapidly driving down greenhouse gas emissions.
Prof. Bowen, just want to quickly circle back to the point you were making about the mental impact. I want to ask you if there is a definitive link over the longer term in terms of exposure to higher temperatures and medical conditions, the same way we can say smoking is linked to a higher incidence of lung cancer, for example?
We absolutely have a very strong connection between heat and human health impacts, so heat stroke and heat stress in particular. But the research is only in its infancy when we starting to understand other health impacts like mental health and violence that I mentioned. The physiological links are very, very clear, and there's been a lot of research, but those other more indirect impacts are really important for us to continue researching and understanding the link. But also, what are the preventive measures? And I come back to the adaptation strategies, for example. Do we have sufficient cooling centres in cities, so places that are air-conditioned that can provide respite, particularly to those people and communities that are at highest risk? And you mentioned many of them: the elderly, people who are already sick, and people who have disabilities, people who are from lower socioeconomic backgrounds. We must place an equity lens on all of our adaptation solutions, and crucially ramp up our mitigation so that we make sure that we're not living in a world 50 years from now that will see 3 or 4 times the heat wave events that we're currently seeing now. So critical activities across all of the spectrum of climate solutions.
Professor Bowen, we'll have to leave it there for now, but thank you very much for your insight this morning. Kathryn Bowen, Deputy Director of Melbourne Climate Futures and also the Professor of Environment, Climate and Global Health at University of Melbourne.